Joe Biden has pledged to bring the majority of elementary and middle school students back into the classroom by the end of his first 100 days in office. And at a virtual education summit today, the president emphasized the $130 billion out of his COVID relief bill that's slated to help schools meet that goal.
I need states to move quickly to get these resources down to the school districts and put them to work. Help is here for schools to purchase PPE, hire additional personnel like nurses, counselors, custodial staff, improve ventilation and sanitation, avoid devastating layoffs, and give students extra support. Getting our kids safely back in school is essential.
To that end, the CDC also recently updated its safety guidance to say 3 feet of physical distancing, not 6, is enough to prevent the spread of COVID in schools, something the Massachusetts Education Department embraced months ago, by the way. But so far, the president's goal is still a ways off. Less than half of elementary school students and just 38% of middle school students were fully in person as of a couple of weeks ago, according to a new study released by the United States Department of Education, which also found students of color are less likely to be back in the classroom. In this state, education officials announced yesterday they expect 90% of districts will have fully in-person elementary schools by April 5th. Several dozen others were granted waivers, including Boston and Worcester, late this afternoon, delaying their return. Commissioner Jeffrey Riley joins me now. Commissioner, thank you so much for being here.
Thanks for having me.
So 90% of districts will have elementary classes open full-time, and I guess it's less than 2 weeks if my math is right. Parents are able to opt out under your directive. Are they opting out?
So we're seeing a large percentage of parents choosing to opt in. I think parents understand that the president has asked that we get our kids back in school, and the science and the medical community want to say that it's safe for our kids to go back now as well.
You know, this state has a long history of local autonomy when it comes to school decisions. You overrode that autonomy, that local authority, by your statewide mandate. Does that concern you? Are you concerned about the precedent that might set, Commissioner?
Yeah, I don't think it's actually overriding local control at all. Remember, prior to the pandemic, school was just school. We actually created these 3 vehicles, remote, hybrid, and in-person with medical restrictions at the state level. And so now at the state level, based on the doctor's advice, we're taking away some of those models and saying that we think it's time to get our kids back in school.
You know, as you well know, the teachers' unions are supporting legislation on Beacon Hill that would delay that first reopening by, I think it is 3 weeks. After months and months and months of what we've lived through, if it would make the teachers feel more safe, obviously would ensure that more get vaccinated, what harm would have happened had you agreed to that?
You know, I think every day that a child is out of school is a missed opportunity and really harmful to their development. And so every day they're in school is a precious time. President Biden and his administration have been clear, teachers don't need to be vaccinated to go back. With that said, the governor has moved up the teachers to begin the vaccination process. I would also say in Massachusetts, more so than any other state, we've done more for the health and safety of our teachers and students than virtually anyone else. Remember, we gave 10 days of training at the beginning of the school year for teachers to plan for health and safety protocols. We sent out air purifiers to districts en masse, and we're probably the only district or the only state in the country that's doing pool testing in our schools right now.
Do you know what percentage of educators have been vaccinated so far, even a ballpark number?
We don't have the numbers, partially because they're drawing the vaccine from different pools, right? There are days that are set up by the Baker administration, dedicated days on weekends, but that's state vaccines, but also CVS, we know, has vaccinated a lot of educators, and they're drawing from the federal stockpile.
You know, I just thought of something as you're speaking, and as a result, since I just thought about it, it's probably absurd, but let me float it anyway. If you're reopening schools based upon age of the kid, why wasn't there vaccination of educators based upon the age of the kid that they were dealing with? You understand my point? I mean, what's the point of putting a high school teacher ahead of a third grade nurse, for example, when the third grade nurse is going to be dealing with kids in 2 weeks, and the high school teacher may not have a kid in front of them for weeks?
So I'm not sure the system is that refined at this point to be able to delineate who should get the vaccine and who shouldn't. We're grateful that the teachers were carved out and prioritized. But I think at this point, to ask to do kind of a further delineation would be tricky. I would also say, remember, the difference between the elementary school reopening and the middle school model in the middle school reopening is just several weeks.
I understand. One last thing about at least this immediate return. The thing that I've been on the fence on this issue, which is easy since I don't have a kid who's school age anymore. I'm sure I would have taken a stand otherwise. But the thing that moved me closest to reopening is when I've talked to shrinks and others about the mental health situation with kids who've been on full remote or even hybrid to a degree. When kids do return full-time to the classroom, will there be resources there to address mental health issues that have arisen during this horrible year?
We've been clear with the superintendents that the reentry could be fraught with kids coming back with trauma.
Yeah.
It's been clear from all the medical people we've talked to that, there are virtually no psychiatric pediatric beds for children right now. Children are actually being warehoused in emergency rooms for weeks on end because of their isolation and depression, the suicide attempts and the like. And so we've got a major issue to deal with when kids do come back to school. We're hopeful and grateful that the federal government has sent additional dollars to help districts think about how to transition kids back. And that includes, having more counselors, more nurses and staff, social emotional supports for kids.
And they're ready to go is what you're saying, yes, I hope?
Yeah, I think they're in the process of being ready to go, right?
Okay.
Remember, we have an initial outlay from the federal government that districts have access to, and then the new addition is coming in the next few weeks.
We had your boss on the radio today, and we were talking about the mandate that allowed you to direct that these classrooms reopen by a specific date. And then we started talking about learning loss, which obviously concerns everybody. And then we started talking about summer school, and here was our discussion, or at least part of it. You thought it was appropriate for him to be granted power to unilaterally direct, subject to parents opting out, that schools reopen. Why, since we're so close, would he not seek the same authority to mandate that based upon certain criteria, summer schools shall, not may, shall be available to students who are suffering from major learning loss, Governor?
Well, that's a good question to ask Jeff, because I don't know the law.
Well, the beauty is I now have Jeff here. What is the law, and if it was legal, would you consider doing it?
So the law states that kids have to have 180 school days. We changed it this year to make it 170 so our teachers could have additional safety days to train. So kids have to make the 170-day mark, but summer school is not mandated. We are strongly encouraging our districts to have summer school, or if they already have it, to increase the opportunities based on some of this new funding that's coming in.
By the way, I'm sure you saw the poll, the Mass Inc. Bar Foundation poll, parents being asked about summer school, overwhelming numbers in every demographic group, particularly high amongst parents of color. You're getting hundreds of millions of dollars from what I understand from the feds to deal with this learning loss thing. Can you give me a brief recitation of what the game plan is? That is horrifying how far kids are set back. We hear when they're off just for, a couple of weeks vacation, how it sets them back. I can't imagine the impact of 12 months of this. What's the game plan?
So we think that our kids will be coming back with significant learning loss, and that we have to have resources in place to make up that ground. I would say, first and foremost, this is not a one summer and everything's going to be fine fix. This is probably a multi-year fix that includes things like summer, vacation academies that happen in February and April over the next few years, and really taking the data we need and then providing the interventions that are necessary for those kids that have lost ground.
Jim Braude, I'm not telling you anything new. You've had a lot of battles this year with the teachers' unions. There were no confidence votes in December. And I compare that to when I first heard of you, when you were the receiver in Lawrence. And I looked up a quote today from the president of the Lawrence Teachers Union. He said that you performed a, quote, minor educational miracle with teachers at the center of it. That wasn't that long ago. What happened? And does this breakdown of the relationship on the state level, does it concern you?
No, I think when we went to Lawrence, We had similar anxiety at the beginning from teachers and particularly their unions. But at the end, I think things worked out okay. And we're always willing to work with the teachers union going forward. And I think at the end of the day, we've tried to do everything we can to provide for the health and safety of our teachers first and foremost, as well as our students. And we'll continue to do that, and we'll continue to support them.
But some of their complaints earlier on about being not at the table when some decisions were made, they're legitimate complaints, aren't they, in your estimation?
I do not think so. I mean, remember, we're the only state in the country that worked with the teachers unions to give them 10 days of training for health and safety protocols, right? No one other state did that. We had them at the table in March last year where we had a document signed by them, the Charter School Association, and the PTA, and the Superintendent's Association and the School Committee Association agreeing on a game plan forward. So I just think that's unfounded.
You know, one of the things they were also looking for was the suspension of MCAS, and I'm aware that the president said that's not going to happen. No suspension of standardized testing. You pushed it back a little bit. But I've read that other states' education infrastructure, I think California, New Jersey, New York, I may be off by one, actively lobbied the feds to allow suspension. Why were we not in that group?
So we have lobbied the feds for a waiver around accountability, which I think we're receiving. But as is typical, we wait to hear from the federal government on what the options are before we decide what to apply for. We weren't sure if the federal government was going to allow for a waiver to not test this year, but they came down pretty hard and said all states in the country have to test. And I know, for instance, Georgia tried to put in a waiver, even though there was no waiver process, and they were just summarily rejected. So unless they put it out, it's not worth anyone's time applying for.
Jeffrey, how hard has this year been for you, both personally and professionally?
Yeah, I mean, I think I enjoy the work. It's been a challenge. There's no doubt about it. I'm worried about my own two children who are in high school and in public schools in Massachusetts. I've seen they've been remote all year long. I've seen the struggles they've had with this. But I'm also worried about, the other 900,000 children in Massachusetts and what this has done to them. And so I think the time is now to get kids back in school and start getting back to the business of learning.
So quickly before you go, we didn't discuss high school, but you reminded me of it when you mentioned your own kids. When do you expect high school kids to be back?
We said we're going to make a decision in April. We really want to take this one step at a time. We understand the president is very anxious to get kids back in school. We're taking a methodical approach here in Massachusetts. We're going to start with the elementary schools on April 5th, then move to the middles at the end of April. We'll make a decision sometime in April on the high schools.
Jeff Braude, good luck. I really appreciate your time. Thanks for it.
Thanks for having me.